In other communities, you see the vegetables when you first go in. You see the fruit when you first go in. You're not looking at flaming hots and all that stuff, which I can't stand. I see myself just going into different stores, especially in the African American community, that the media is key. It's the cake, it's the chips, it's the soda. Then you have to hunt for the fruits, the vegetables, the bottled water, things like that. Like in the black folks neighborhood, we've got 50 liquor stores. Every time you go a block, you see 2 or 3 liquor stores. You go in the white people's neighborhood, you may not see but 1 liquor store. They're not going to sit that close together versus how liquor stores are. We've got one on 39th in Indiana. You ride up 4 more blocks and you've got one on 35th. Then you've got another on 24th and State. Lastly, I would like to talk about community violence and safety concerns, because many times we talk about products, but many participants talked about safety in relation to getting around the neighborhood, the hassle of needing to use certain types of risk management strategies, as well as coping with the overall context of deprivation. One of the participants took a photo of this store in the community. They said, the dollar store is on the other side of the street. Drug sales go on outside of the doorway. You see people hanging out in day in and day and night. I was approached, me and my son walking to the store with my boyfriend's brother, and this older man, and it was daytime, and a man on the street was drunk, and everything he said, something, Bob, the guy I was with, said something to him because he said something to my son. So little stuff like that. And many people talked about sort of the daily hassles of dealing with safety issues. So in conclusion, the idea of this paradigm shift to avoid this thought about health issues only being related to lifestyle versus the communal context and other social determinants of health. And partly what I would like to think about, sometimes when we talk about this issue of violence, people talk about Inglewood is violent, or they talk about these other negative things about a community, or calling a community a food desert. In some ways, when you think about the challenges that people face and the resilience that they have within these communities, partly what I would like to think about, and when I talk about the recommendations, is this idea of an asset-based approach. Many families are dealing with challenging issues, yet they're able to be resilient in spite of those issues and really organize and try to bring resources into their own community. So when you think about social determinants of health, life choices are actually heavily structured by life circumstances. And life choices by themselves actually account for modest proportions of health status. And life choices are difficult to change without considering life context and bringing resources in communities that might move beyond just the food issue, but go to the employment issue, go to the violence issue, go to other issues related to mental health and stress. And so participants made several recommendations. They talked about changing the perceptions of communities to think about the residents, increasing efforts to reduce community violence by creating a safer environment around stores, as well as creating programs for youth to give them a variety of options and economic opportunities. To offer tax incentives to bring different types of retailers in the community that offer not only food but other services and goods. To improve the physical appearance, cleanliness, food quality, and customer service at existing stores, as well as promote the development of minority-owned food retail businesses in African American neighborhoods. So our next steps for the project, we're in the process of interviewing policymakers and business owners to see what challenges they face in communities, and then we've planned a community forum in collaboration with the Inglewood Garden Association and Teamwork Inglewood on June 18th at Kennedy King College.